And welcome back. I'm Mabel, Jong. You're watching WHCC TV. Thanks for sticking with us. We're your one-stop shop for all the great content that's coming out of this conference this year. And in our studio right now, we have Michael Bush, VP for Post-Acute Care Growth and Strategy at eviCore.
Hi, Mabel.
Hi, how are you doing?
Great.
Good. Tell me a little bit about what eviCore is, what it does.
Sure. eviCore is essentially a medical benefits management company. We work with health plans, we work with various other risk-bearing entities, mostly health plans, to help manage their costs in certain areas of spend. So whether it be through prior authorization, in the case of some supporting prior authorization on behalf of our clients, as is the case with some of our programs, or more of a care coordination approach, which is what we do with post-acute care. We're there to help manage their costs, improve the quality of the member experience as well as the provider experience. So we just assist health plans and other risk-bearing entities to accomplish their objectives.
And what first and foremost is on their minds now in this healthcare environment? Is it cost savings, high quality?
Well, it's always, I think the easiest way to think about that is the old adage, the triple aim. If health plans, if you're a leader of a health plan, you're thinking about how do you reduce costs, and how do you control costs? How do you improve quality, and how do you assure access? Now, access is a little easier than it used to be now because of some of the changes to the regulatory environment, but it's still a challenge to make sure that everyone has an understanding of how the healthcare system works, how to utilize it efficiency. But again, it comes down to cost, access, and quality.
And are you satisfied with the direction the industry is taking right now? There certainly is a lot more focus on the triple aim and trying to achieve those goals. How are your members feeling about that?
Well, I think it's always a challenge. I mean, healthcare is a huge, mammoth issue. There are a lot of things that have happened over the years that are going in the right direction. There's still a lot of problems to solve. I mean, the cost problem is still a huge issue, and it continues to loom ever larger, and there's always fundamental issues around what can we do to make sure that we're addressing that relative to and continuing to improve and enhance the quality of the experience for members. I think there are a lot of things that are going very well. There are a lot of improvements that have been made. Well, I think, for example, the move from the adage again is from volume to value. The idea of rather than just paying for services or just providing services, it's creating incentives in the system at both the member level, the payer level, and most importantly, the provider level to provide a high value, high return program that emphasizes health, that goes back to those triple aim issues. There's been a lot of movement in the right direction in that way. I think a lot of the things we're hearing about at this conference will be talking about that. I certainly think that what we do with post-acute care at eviCore is centered around that. It's the idea of creating a holistic experience that goes from, in the case of post-acute care, goes from hospital discharge to when the patient gets home. Everything that happens in the meantime. It's not just about the hospitalization, it's not just about the brick and mortar facility, it's about what happens to that member. Do they go to a long-term acute care? Do they go back home to a home health environment? What happens to them in the process? What's being done to prevent them from readmitting back into the hospital, which is a disaster, really.
Sure, what everyone is trying to avoid.
Right.
What is eviCore's work in this? How are you coordinating these entities better so that you can achieve the triple aim?
Well, our post-acute care program is a true care coordination program. Not only does it provide aspects of utilization management, which in this case just means trying to find the most efficient and the most cost efficient and yet highest quality alternative for some of that post-acute care experience between the hospital and home. But it also, we work directly with the providers in the markets that we serve and help with those providers to create plans of care to optimize the member's experience from hospital to home. So whatever's right for one person is not going to be right for another person. It's going to be an individualized thing. We're very proud of the program that we developed to create individualized plans to optimize, not just to optimize the cost effectiveness, but also to have the highest quality outcomes. That means that we are on the ground, so to speak, with the providers in a market that we serve. We work directly with the members. We create a very much a positive kind of episode of care kind of environment that's designed to create a patient journey from the day they walk out of the hospital to the day that they get home, and doing our best to make sure that they don't go back.
Where are the greatest opportunities for companies that want to be involved and more invested in this process?
I think there's a couple of things. I think first of all, it's very important to think of the experience as a holistic event, right? It's not just one event. It's not just going from the hospital to home, or to the hospital to a sniff, or back, to a home health piece. It's a whole process that can involve any number of different things. I think the opportunity is to create interoperability between those different elements, to create between the different aspects of what happens when someone leaves the hospital and when they go home, to create better communication. I think that's a big part of it. I think the second thing is enabling that by creating technological links between all those different elements. And that's what eviCore can do. We can step in, we can create the glue, so to speak, between all of the different providers that would touch that member going from between the hospital and home, as well as the payer that's coordinating all of the insurance aspects of it. There's a lot of notification that can take place. There's a lot of information sharing that can take place that doesn't automatically take place, oddly enough, because there really should be that kind of, it seems like an obvious thing, that there should be this high level of communication, high level of interoperability, and in many cases there hasn't been, and that's what we're trying to solve for.
Can you give me an example of how you've worked with members to create that ecosystem of support, and what might not have happened if you hadn't stepped in?
Sure, I absolutely can. eviCore is uniquely well positioned to do that because we manage a lot of different aspects of healthcare spend. So a good example of that would be, we work with a client for which we manage post-acute care. We also manage musculoskeletal services. Well, because we have these notifications and this information sharing capability built into what we do, we're able to learn about a potential post-acute care episode before it even happens, because we can identify an acute situation, for example, in musculoskeletal services, that then will result in a hospitalization, that will then result in a transition for the member from the hospital to home. And that's where we are able to kind of get ahead and figure out what the best thing would be. Another example is that we work with very, very advanced proprietary predictive analytics, meaning that we're able to take the data that we get from the payers that are our clients, as well as data that we've established from our relationships with them on other programs like musculoskeletal, as well as some of the notification type information sharing services that we have, to predict what that member's experience will likely be, and figure out in advance how to optimize it. Without having us in place, none of that would have taken place, and there's a lot of, not only is there a lot of money to be saved by using us for a health plan, but also there's a lot that can be done to make the experience better, not just for the member, but also for the caregivers. Because the truth is, we deal mostly with, most of our business for post-acute care is with Medicare, and that tends to be, seniors, Medicare beneficiaries that work very closely with family members, with loved ones, that become the de facto caregivers. I think we've all had experience where we've had a parent that has had some sort of hospitalization, and then we've had to step in as that parent's children to kind of see them through that process. We work and we try to identify and be a resource for not just the payers, not just the members, not just the providers, but also the caregivers.
Why bring this message to the World Healthcare Congress this year?
Well, because it's a huge area of spend in Medicare. Post-acute care is one of the biggest areas of spend that there is in Medicare Advantage. So not only is there a huge opportunity to save money for our clients, but also a lot of kind of less traditional things are happening relative to how risk-bearing entities are dealing with post-acute care. Right now, there are several types of entities that are facing downside risks as well as upside risk for the services they provide. An example would be accountable care organizations, ACOs. Many of those have post-acute care management responsibilities and have lots of opportunities to save money. So instead of just being the health plan that is doing this in conjunction with some kind of third-party provider, there are actual situations where the providers themselves are the risk-bearing entities, and we can provide a lot of service through all the tools that we have to help them to become more adept at what they're doing, save money, but also more importantly, improving the quality of care.
Are you reaching a specific audience at a meeting like this?
We tend to, on one hand, we tend to, right out of the chute, we tend to speak to chief medical officer types, providers, leadership people for both payers and risk-bearing entities like ACOs, that type of thing. But we also are interested in talking to the CEOs of organizations like this, as well as the CFOs, because there's a big financial component to what we do. I'll give you an example. We manage our programs on a capitated risk basis, which means that we assume responsibility for the areas of spend that we manage. Now, why is that important to a health plan CFO? It's important because they can guarantee that what we say the cost will be because we're at risk for it.
Yeah.
Hopefully it's lower than what they're spending now, because we think we can improve typically on the quality and the effectiveness and efficiency of the program that's in place right now, or the self-managed program. That's important for the CFO, because then he or she can then set their Medicare rates knowing in advance what the spend will be in this very important area, post-acute care, which represents a big percentage of the total spend. That helps them to be more competitive, that helps them to be more effective in the way that they operate their business. So it's not just a medical thing, it's a finance thing, it's a business thing, it's a very strategic thing for how a health plan is positioned or how a risk-bearing entity is positioned in the marketplace in general.
Okay, Michael, thank you so much for
My
filling
pleasure.
us in. I appreciate it.
Thanks.
And I'm Mabel Jong. Thank you so much for joining us today. We'll be back here bright and early tomorrow. Stay tuned for that.